Welcome to Find Your Shape, a podcast by Lewisburg Plastic Surgery featuring Dr. Alexander Moya, the expert in body contouring after weight loss and inventor of the Corset Body Lift. Hi, my name is Brittany, and I will be your host. In each episode of this show, Dr. Moya and I will discuss the complex world of body contouring after weight loss. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision for your personal situation. You've lost the weight, now let's find your shape. Hello again, Dr. Moya. How are you?
I am great, Brittany. Looking forward to another podcast.
All right, me too. So, hot topic here, BMI. And can you tell me how that plays into considering a patient for surgery?
That is a very hot topic, and it's an important one because it helps us stratify which patients we can treat and which ones maybe we need to wait a little longer to get them a little lower on their body mass. And BMI means body mass index. Mm-hmm. So it is a good indicator. It helps us to decide, can we do something for a patient, get a good result, but really, can we do something and do it safely?
Right.
So when it comes to body mass index, for me and treating weight loss patients, I really don't follow the standard rule. Mm-hmm. I kind of, I kind of make my things up anyway.
You sure do.
You got to fit what works for you, right? So I've been doing this for almost 20 years, so I know what works for me in my hands. So I'm not going to say that what I do can work for everyone as a surgeon. It's what works in my hands. So for me, the body mass index, I do use it, but it's completely different, the standard index that most surgeons will use.
All right.
So when it comes to specific procedures, I use it to help guide me, has the patient lost enough weight? Let's put it that way. So if we're looking at waistline contouring, for instance, that's really the best one. I will use the body mass index to help guide what procedure might work for the patient. So if a patient is what we say normal BMI, we'll put that in quotes, right? Normal. Less than 27. I'm 27, or 27 and a half. So they put me that I'm overweight, whatever. I work out a lot, but I'm denser, so that doesn't really fit. But at the end of the day, if somebody's less than 27, then they're ideal candidate for most procedures, especially a regular tummy tuck. A single incision, lifting up the skin, pulling it down and getting rid of the excess. Anything above that, you have to start thinking about, can I get the right shape, and do they increase the risks of a wound healing problem? And so for me, I'll use for tummy tuck, my body mass index cutoff for a tummy tuck is about 36, 37.
Okay.
And that would put it into a plus size tummy tuck.
Okay.
And I do things a little bit differently. Then I would do a lot more liposuction to help me lift the skin rather than just lifting the skin. So it's what we call a discontinuous type of procedure, meaning I'm not directly cutting all the blood supply away. I'm using a cannula to lift up the skin in small areas that still makes it loose so I can pull it down. Okay, that's one way that you can get away with what we call a plus size tummy tuck with liposuction. Now, if somebody has a higher body mass index than that and they're looking at waistline contouring and they lost a lot of weight, anything above that it'll exclude them from a tummy tuck, a standard tummy tuck, but now we start going into these more non-standard procedures, meaning like a fleur-de-lis tummy tuck, or even going to a corset body lift. And the reason why we can do that is, again, because we're not lifting skin. Very, very important. Eliminate some of the complications that we'll see with patients who will have a higher BMI. And now we're talking about higher than a BMI of 37, talking about a 40 or 45. So I have found over the years that my criteria for weight loss, according to the BMI for waistline contouring, goes like this. If a patient if a patient is between a 37 to a 40 BMI, but they've lost at least 100 pounds, usually their skin is mobile enough, mobile meaning that I can move it by pinching it together, that I can actually remove enough skin and give them nice shape without having to lift the skin to do so. Okay. And of course, that's with an up and down incision. Otherwise, you're not going to be able to achieve that with a incision just at the bottom of the tummy. Okay. I find that at that level, I can help them. Now, if somebody comes in and their BMI from 40 to 45, which is not uncommon for my practice, because I'll see patients who've lost maybe 150, 200 pounds, or those patients that just have really loose skin and they don't really fit into that category, but they have enough loose skin that they resemble that. where I can still help them with waistline contouring as long as we, again, follow the rule of utilizing a tailor tacking procedure, an up and down incision, either a fleur-de-lis or a corset body lift.
Okay.
I have helped patients between 45 and 50 BMI.
Right.
But that's because they were 80 before. The minimum at that level is 200 pounds, 200, 250, 300 pounds. I mean, this is why we come up with these procedures, so we can help people, right? This is what we're about. We're about helping as many people as we can and not saying, oh my gosh, you're a BMI 45. You need to lose more weight. And they're like, well, doctor, I already lost 200 pounds. I'm 250. I'm stuck.
Right.
Not for us. Come on over here to lose plastic surgery. We can help you if we can do the right procedure, which is an up and down tailor tacking procedure. So I do use the BMI as a quick thought. Okay, does this patient have a potential risk of surgery? Can I help this patient? Once that's done, it becomes an individual thing because it all depends on how mobile your skin is.
And now, what about other areas, extremities, backs? How does that apply?
Well, that's a great question. I'm not going to be able to usually help somebody at BMI of 40 if we're looking at thighs, for instance. And again, why? It's not mobile enough, or there's so much, I don't want so much skin, it's not deflated enough that we can actually achieve a good result. Okay. And then we'll never do it. Doesn't make any sense. So it's not necessarily that there's a risk for a wound healing issue. It comes down to the fact that if they're a BMI of, let's say, 37, 40, 45, and they're looking at thigh contouring, probably that thigh isn't deflated enough.
It just can't be done.
Correct. It doesn't move. That's the reason. So in our head, it gives us an idea, I'm not sure if we can help that person, but then you never know. That's why it's individualized.
Right.
Have the patient come in, examine them, or send photographs, and we can kind of decide that. So thighs would be way at the bottom, meaning most of the time, if they're above a BMI of 37, it's hard to help. The next one up would be arms. Arms, I've helped patients in their BMI of 40 because their arms can be deflated, even though they're BMI 40. So I don't really necessarily have a criteria for that. The cutoff for me would be about 40 for arm contouring, I guess, if you were to ask me, do we have a certain cutoff? And it's interesting because it's changed over the years, with the techniques, meaning we can actually deflate some arms before we actually remove the skin.
I was actually just going to ask about that. Is it possible if somebody's been stuck at a certain weight for ever and ever, and could they possibly do the deflation lipo safely under surgery, under anesthesia with that higher BMI, and then come back later to have skin removed?
Absolutely. So again, we're here to help patients, right? If somebody's lost 100 pounds, stuck at a BMI of 40, their arms have always been a big issue for them. We feel that we can help them, but in 2 stages. We could do a deflation liposuction, let them heal for a good 6 months, come back, and then remove the skin.
Okay.
I find that usually with arms, I can do it at the same time. So for those patients, we can do extra liposuction.
Okay.
Get the deflation in the OR, then remove the skin with a tailor tacking technique. Thighs, not so much. It's better to do the deflation liposuction if they're a candidate for it. Let them heal for a good 6 months, and then come back and reevaluate them and see at that time, is there loose enough skin? Does it make enough of a difference when we pinch it to do skin removal?
Okay.
But again, it's kind of guided again by the BMI.
Right.
So it gives us an idea when we're having patients come in or they're consulting us. It gives us the idea of the first thought. Is this somebody that we can help? What are the things that we need to look out for? So that's the way I use the BMI. It's more of a guide in my treatment protocol.
But not set in stone.
Correct. And that's really important. That's why patients ask me, well, what's your BMI cutoff? I mean, it's a long answer. At the end of the day, It's individualized. I gave you my thoughts about the different body areas when it comes to BMI. Then the key is to see how much weight they lost and how loose is their skin.
Perfect.
Okay.
All right. That's a lot of great information. Very helpful. Thank you very much.
You're very welcome. Thank you.
That's a wrap on this episode of the podcast, brought to you by Lewisburg Plastic Surgery and Dr. Moya. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery or the Corset Body Lift by Dr. Moya, please visit us online at lewisburgplastic.com. We'll see you next time.